Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And wouldn't it be amazing if you could just consult with somebody and she uses something, call it intuition, and she tells you what's wrong with you medically, why you're having pain, why there's challenges here, challenges there in your body. She's not a physician per se. She's a medical intuitive. And what if she was very accurate? I've tested it. I found her. She's here. We're going to talk about that and also pain and pain management with just an amazing woman. She is Dr. Gloria Warren, and she's back with us. Welcome. How are you doing today?
I'm doing great. Yourself?
Very well. Very well. I want to, before we do anything, I want to share that we did a session live here a few weeks ago, and some of the things you told me were right on target. Some was one other thing that you said, and I'm like, man, I really don't know. And I experienced something over the weekend since then that validated that you were right on target about that thing. So I don't know how you do what you do in terms of the medical intuition, but it works. And I want to, before we do anything here as well, let people know that you're not just some kooky psychic. You also have a medical background, correct?
Yes, absolutely. Started out in laboratories and went into medical assisting and surgical assisting and pharmaceutical research for many years. And I thought I was supposed to be a physician, but I'm more on the research end of it now, which I'm glad I did it that way so that I can follow my journey as a medical intuitive.
So what happens when you do a reading? I'm calling that loosely. I'm not sure what we should call it. Um, and there's some challenging things that you find. How do you deliver that to somebody?
Well, I follow my guides and I believe wholeheartedly in everything they show me and tell me. So in the beginning of the session, I make sure that they want to hear spiritual things. I'll tell them that too. If they want to hear just medical things, depending how bad it is, if there's something really bad, do they want to hear about it? I check with what they want as far as the depth of the reading. So I don't shock anybody. If I see cancer or something like that, if in the beginning they said, oh, I want to hear everything. Okay, then I'll just shoot it out there. Or I'll say, you have a tumor in your head. It's right about here, about back. And I tell them to the limits that they set in the beginning of the session. So, and that's usually symptoms, causes, and solutions are my three sections. And spiritual can be mixed up or whatever I'm guided to tell them.
It's like one of those things, you ask for it, you're going to get it.
Right. That's what I'm here for.
And listen, if you went to a doctor and they did tests, they're not going to not tell you. So it's kind of the same thing. You just go about it a different way. You don't use traditional tests, you use intuition. When it comes to solutions, how does that look? It's great to have the diagnosis, but
right. Well, let's say if I'm looking at pain management, because everybody knows you're always in pain here and there throughout your life. And first thing I do is I look at the symptoms, like what I am seeing within them, whether it's chronic or acute, intermittent, steady. It could be sharp pain. It could be aching. It could be throbbing pain or something of that nature. And then I look at the causes of what's happening. There's so many different causes. And if you're listening out there, consider some of these when you're thinking about yourself. Dehydration, big cause of pain. Low circulation, swelling or inflammation with a pathogen involved. Pinched nerves, whether swelling or misalignment, muscle tension, organ dysfunction, a virus or bacterial infection. And I can go on and on. Then I move on to the solutions or the root causes of the problems, but the solutions are really that real good acorn they can take home with them and work on trying to get better and resolve some of these issues. So outside of actually sending them to their physician, they can take the information with them to their physician. I entertain calls with physicians all the time, and in solutions, it could be simple things that even you could do at home, such as stretching or heat and ice, or heat and ice, red light or UV light, realignments, going to a chiropractor, medications, homeopathic, Ayurvedic. One of my good friends, Dr. Kamadeka, he is in charge of the Pain Management Institute, and there are physicians involved in that as well. So maybe sending them to a place like that would be what they need to see. Or maybe they need to go do their stretching with a yoga. It's something that's a little more than what they could just do at home. I'll suggest going to a yoga studio and trying to find somebody with a specific type of yoga. So there's all those facets to what I do. And, usually a reading's an hour and a half to 2 hours. And I try to touch base on all the needs to make sure their needs are met. And then if the needs aren't met at that point, I'll let them know, you know what, I may text you in the middle of the night tonight. Please just, know that I'm a human being at the same time. And I may have forgotten something or passed something up that was less significant at the time. But I feel a real need that they need this information. So it may continue, and I may entertain another call with them the following day. If they have questions, I want to answer it. If they can't read my handwriting, I want to, reiterate, or at least let them know what it says. And I try to be it's a holistic read. It contains so much information. It's not just this is this, this is that, and that's what you do. Our human bodies are massive, and we have so many systems in there that it's a lot to look at, but I try to target their needs. It's very individualized sessions.
I'm glad you brought up the point that you consult with your doctor. Certainly,
Yes.
You're just another call tool that can be used
Exactly.
in the diagnosis of something. Sure, have at it.
Yeah.
Go for the MRI, go for the sonogram, go for the lab tests. But you could be someone that starts the journey, or you're midway through the journey when there's questions and you're not getting the answers from the doctor or the attention, big problem today, or anything. You're the alarm system, like, whoop, whoop, whoop. Hey, might want to take a look at that. What do you have to lose as a patient or a potential patient just to say, doctor, somebody told me about that. You don't even have to go into the details. You don't have to say if some might be embarrassed. I have no problem with it. And say, I went to a medical intuitive, and this is what they said. You could just say, hey, I know somebody that's in the medical field, and they said that I really should look into fill in the blank. Can we please do that? And if your doctor says, no, I'm not going to do that, might want to look at for a different doctor, or just relook at your medical strategy.
Yeah, I'm just another tool, another vessel, or a lens per se. And I'm really good at finding things that the doctors have trouble finding. I've actually helped some physicians with patients, and they were grateful for what I did for them, and I'm felt very appreciated that. So, but in my own personal practice, I am a good first stop, because I can guide people towards the correct things they need, which I did at a healing center I was working at for a while. They would have them see me first for short sessions, so I can help them figure out what is it they need. They'll ask me, well, what holistic practitioners should I see? This is a big one, Well, in your case, I think you need to see, and I'll give them X, Y, and Z. I think that's your primary area that you need to see, because most people have a difficult time figuring out what type of help should I be seeking out here. Should I see a psychic? Should I see somebody that does remote viewing, or should I see someone that does other types of alternative, or maybe just even a chiropractor? So I can actually do a quick glance through. It's usually 20 minutes long, and I can guide them towards the right practitioners, as well as if they need to see a physician. I could mention, go see your general practitioner, and maybe request her to check this out or that because you think you may need to see a cardiologist or you may need to see a neurologist, something on that nature. So good one stop, first stop.
Yeah, I'm seeing you in a different light here too, in that you are everyone's medical advocate because of your medical background. So even if you factored out the intuitiveness here, you've got experience to help someone realize or help their medical practitioner realize that, yeah, maybe you look at this, take a look at that, take a look at that. And that all comes with your experience. By the way, I want to say that the intuition thing, police departments use psychics to solve cases
Right.
all the time. They don't talk about it. I know the
Correct.
psychics. I've spoken with them. It happens fairly frequently, and it helps law enforcement get leads to just what you're doing. You're a lead looking
Right.
into something. So, for those who are afraid to admit that, well, I went to a psychic and they told me that I might have a tumor or whatever it might be. I think we need to get past that.
We do. We
Right?
do. I actually helped on a case. The first time I helped on a case, the partner who was in this other country and had just been debriefed wanted to be arrested. I knew too many details that nobody else knew, and I knew exactly where to find this person, and it was just really sad to me because it needs to be a little bit more of an open mind with some of these departments because people like me really do exist. And to turn their backs and say, oh, she must be involved because she knew about this rope or she knew about that, that's not necessarily true. And I do think the environment that we work in has become more open-minded, but it has a long way to go. But I don't want to stop other psychics from hindering them from going to the police department. I think we all need to start to help more so in these environments.
A final thought on what we're talking about at this moment, but some surgical suites will allow Reiki practitioners to come in and use Reiki to spread good energy, but not just to the patient that's going through the surgery, the surgeons as well.
Yeah.
And this would be way more widespread. Why doesn't it happen? Simple answer, because insurance companies don't allow or are uncomfortable with having others in the surgery area. So they're forbidden from going in. It could be a DoorDash delivery person. You can't come in either. Doesn't matter who you are. But that's what's going on. But my point here is that the holistic end of all of this, or the energetic end, and you work in energy as well, is accepted by the medical community. So why shouldn't we all accept it and get more in-depth answers as to what's going on with our health?
I agree. And I think that if like I'm a Reiki master too. So if in that case where surgeries are involved, I could see a physician that's going to be doing a 7-hour vascular transplant surgery or something, asking somebody like me who I've been in operating rooms before. So I could stand in the background and just shoot energy to the physician to keep him mentally alert and mentally, able to complete the surgery with all of his cognitive functions intact, because it's exhausting for physicians. It really is, especially surgeons. But yeah, there's so many different uses. And that goes back to if they could feel the energy with their own hands, they'll know it really does exist. And you can transport it across the room at people. So maybe they just need a simple session, being able to see energy and feel energy, what I've done for you before. Maybe they just need to see something like that in person.
So give me those three things again that ends with solution.
So it would be the symptoms, the causes, and the solution. I also look at root causes too with that. Very important because after all, if you want to cure an infection, you want to kill the bacteria as well as just take care of the area and debridge it and clean it up all the time. You really need to target inside and out.
I'm going to get personal and I want to share the process. Now, I I'm close to somebody whose father had a knee replacement a year and a half ago. He's back in the hospital, apparently got an infection in the knee replacement. Doctor said it's like maybe 2% chance of that happening, but it happened. Excruciatingly painful. They're continuing to do tests to find what kind of bacteria is in his body. Not just painful in the knee, his whole body is in pain right now as he lays in the hospital. I mentioned it to you before we get on here, and you shared some information with me. I'm going to share it with those involved, but red light. I don't know if red light laser therapy was something you brought up. And the thing that impacted me, aside from that, was that you've experienced many situations with knee replacement challenges, right?
Yes. Yeah. See, I mean, it could be just dust as they're doing the knee replacement, dust getting in the tissue below where the replacement is or above. And it could be festering, and it could actually carry bacteria, or it could be a toxicity level from the metals of the replacement, or just simply swelling and fluid retention around the replacement. I mean, there's a whole list of reasons that could be causing the problem.
Sure.
So that's why they need to see a physician to find out what the cause is. But in the meantime, to prevent infection, you could use a red light laser, a 650 to 665 red light laser, and that's the research doctor of which I am. Saying that that actually kills all bacterias, even MRSA infection. But that's something they would have to do every day, and it's not an either or, that or a physician. I mean, you should definitely go through and listen to your physician, and recognize what he's trying to tell you and follow through. But at the same time, you could be doing this as a supplement on your own. You can even tell your physician, hey, by the way, I've been doing red light laser every 2 to 3 days, and it seems to be helping. And if he puts you on antibiotics, take your antibiotics.
Sure.
Obviously they do a bacterial microscopic and a cross match to the drugs, so they know which drug is going to actually kill that bacteria most effectively. And then so you take that, but you can work from the outside in, and you can do all these beautiful things helping your physician get rid of this problem.
So to go hypothetic here, in this situation, we just use it as an example. Would you be someone who would connect with a patient?
No, I'm joking. Go ahead. Sorry.
Try to put this together in my mind. Let's say you have a patient going through something. Would you connect with the patient to give further insight, even if they're in the hospital? Just hey, you do your thing in terms of intuition, and let's say it's a knee replacement, and you might come back and say, you know what? The hardware that they used, there's something going on, whatever you come up with. But even in those situations, for somebody in a hospital or somebody going through acute situation, you could use your intuition to maybe give some more insight.
Correct. Yes, I've gone into hospitals and lab coats behind the physician to look at patients where they were not quite positive exactly what was going on, because so many different things can be happening at once. The synergy of things can be so muddled. So I would just talk to the doctor after and let them know, this is what I saw wrong with this system. This is what I saw wrong with that system. You're getting these symptoms. Most likely it's this and that and the other thing. And this is probably going to work right here. I'll even tell them sometimes, if you do a blood test, you're going to find this in their blood, and you're going to notice that. And I'll have the specifics of what they need to test for that are outside the normal realm of usual chem testing and hematology testing. So that's usually something they're very grateful for.
Now, I've had Reiki before that was virtual. It was even done where the practitioner, we didn't even talk, got a text. I'm going to start at 8:00. I'll be done by 9:00. It worked great. I don't even need to get into why it worked so well, but it worked. Is that something you can do as well?
Yes, and you can do it. I find I can do it on the phone. My Reiki master used to do it to me on the phone, and then that allow me to pursue the master's certificate. So it works. And it's amazing, etherically, if you project and you have the person on the phone and you can make your mind actually go there, almost like a remote viewing, being there with them and actually making it work. And it's wonderful. On Zoom, I'm not privy to wanting to do that on Zoom, but I will do that over the phone, or in person, of course, is always the best.
Sure. Well, you get little nuggets of information when you talk on the phone.
Yeah.
But how would you make that connection with somebody that let's say somebody's nonverbal, whatever it might be. Would you connect with them using your intuition without seeing them on a Zoom, without being on the phone?
Great question.
And do you need to have, as you know, my understanding, when you make those connections, that person's permission?
Well, yeah, you always need that person's permission to grant them information. The other thing is I've learned some sign language because in case people are not, can't hear very well, or maybe they know sign language. I know the basics. So between the combination of intuition and using certain sign languages, with the person, we can communicate fine. So it's the same with other languages too. If I'm with somebody that knows a different language, I can still communicate with them. And it's really odd because sometimes I'll hear Russian and I don't know Russian, but yet I know exactly what they said. So, that tool comes in really handy, but I do want to learn to speak other languages more so than what I do now.
Yeah, well, we all have the same medical type issues. It doesn't matter whether you speak English, Russian, Spanish. Doesn't matter. Doesn't matter. The body is the body. Gloria, how do we connect with you? I know this is woo-woo. People must have questions. We run a little deeper here in what you offer, but I find it fascinating. And in my exploration of energy and intuition, this is just right in line. This is just another aspect of it. So it's not Reiki. You're using different type of energy to figure things out.
Mm-hmm. There, for the grace of God, go I. Anyways, though, you can contact me through my website, Gloria, medicalintuitivegloria.com. The best way to contact me is texting at 715-892-6304. So it's 715-892-6304.
You got nothing to lose. Think about how many lab tests you get done, and sometimes they're not accurate. So, why not, right?
Yeah, there are lab errors, but they're getting better and better with technology, but we are still all human using that technology. So
exactly. Yeah. Gloria, great talking with you today. Always love your insight, but especially your energy. It's just feels good.
Hyperactivity disorder. Can you tell? I'm going to go climb a wall.
Send some of that over here. Have a great weekend. We'll talk soon. Okay.
All right. You have a good one. Thank you.
Too. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes. and rebuild lives.
Because of you, everything's just going to be okay.